Just you can start, Irene.
Okay. So thanks very much, Dr. Philip McMilian, for joining me this evening. And I'm very excited to partner up with you, especially at this very stressful time. So I really want to talk to you about the current situation with the coronavirus, then talk about this membership program that we have. So first of all, I think most people would know me from the Smovey Health page. My name is Irene Treacy and I am director and founder of Smovey Health. And we will be working with SmoveyMED, which is vibrational therapy tools. And Dr. Philip McMilian, I'd like you to introduce yourself and tell us a little bit about yourself, please.
Hi, thank you very much for having me on, Irene. And I too look forward to working with you, as I have for quite a while now, probably over 2 years that we've been in contact with each other. And so I am a consultant physician in the United Kingdom. I work in stroke and general medicine. So that means I see lots of patients with all kinds of issues. And I have been interested in Smovey for some time and its neurological effects on people. So I've been researching that for a while. And that's where I've had that introduction through Irene to this quite remarkable system. So yes, that's a bit about me. I have quite a passion with regards to dementia. I've been researching dementia for a long time as well, and an international keynote speaker on that as well. And I usually like to talk about anything with regards to health and medicine generally.
Okay, thank you very much, Philip. And I know we have been working together for a couple of years with the neurological side, with the Parkinson's and dementia. However, with this current situation, the coronavirus, which is really capturing the world, we thought that we would focus on how really the SmoveyMED can help both your patients, my clients, and how you know we can do so much to help ourselves and our loved ones. So if you wouldn't mind, Dr. McMillan, can you just talk us very briefly about coronavirus and how you think that SmoveyMED will help us, our loved ones, please?
Yes, I agree, Irene, that we're facing an unprecedented challenge. And even now, as in the UK, we're gearing up for what looks as though it's going to be quite a serious health crisis. At the same time, we recognize that these are challenges that we have to face at this time. So this very novel coronavirus, I guess some people call it coronavirus 2, because the first one that we'd seen was the SARS epidemic that occurred in about 2003, 2004 in China and Hong Kong, and I think some cases in Canada. And that one thankfully settled, but we've now got an even bigger challenge that has become a global pandemic because of this very, very contagious virus, which causes quite a significant respiratory problems in some patients. And this is where the big challenge with this disease comes, is the amount of people who can get infected with it, and then the impact that this has on a specific proportion of the population, especially the elderly and those with health issues.
Yes, absolutely. Worrying times ahead for us. And can you talk to me, Philip, please, and how you think that the SmoveyMED can help our clients and your patients with, especially with respiratory systems, and how you feel that the SmoveyMED can help our immune system overall, please?
Yes, well, I think I'll start first with some general principles. And what I'll say is that even before we get to the SmoveyMED, There are just a few simple things that people can do that can actually make a little bit of a difference in terms of your resilience against the virus. Because many people have it without symptoms, and what you want is you want your lungs to be as healthy and as strong as possible. So for one, I'd ideally ask people who are smoking to stop smoking. Even though it may make your chest a little bit worse, it's one of the things that will help. The second thing is there is a specific compound that is produced in the lungs, and it helps the lungs to be able to inflate properly. And it's a thing called pulmonary surfactant. And it's like a lining or a covering on the fluid that already exists within the alveoli in the lungs. And what you find is that a few simple things can improve it. And the one that I'd encourage people to do is deep breathing exercises. And that's just I simply say, take 4 breaths in, 4 breaths out, hopefully when you're walking or doing some kind of exercise. And just that simple action of expanding your lungs increases the amount that is produced in the lungs. So it can even be simple as blowing a balloon. That action of having to inflate deeply, inhale deeply and blow out helps protect your lungs. So that's just one of the things that I'll be able to share with people over time that can be done to make a difference to their health today. But specifically with regards to the Smovey, and because I know that the people who are probably listening to this either have seen or probably are using a Smovey, and it's encouraging for them to know that what we've found is that the Smovey, through the vibration, stimulates the sympathetic system. And that's closely linked to stimulating the immune system as well. And what it does, it helps the body to mobilize those white cells that will help us to fight off infection. And it also helps to increase the amount of cortisol that will be produced simply by stimulating the immune system, the sympathetic system, and it just boosts that immunity. And so I'd definitely encourage people who already have that SmoveyMED to continue to exercise with it through this period of time. If they need to be isolated, the beauty is that it can be done at home without you needing to necessarily interact with anyone. But it's also a great time to use the online system that you're offering, Irene, to be able to engage people and to keep them active.
Yes, yes. So thank you. Yeah, we have introduced a new program because we had to stop all our classes here in Waterford and around the country. We have some classes in the UK as well, and we had to just stop them. So we are bringing an online program, and we're delighted to do that in 2 ways. We have Smovey Health Fitness and then Smovey Health Neurological. So we'll be doing it on 2 different platforms. And this will be released with 2 new classes every week. And also I will be doing a breath work and a meditation. So it's really, really important at this time to keep our stress levels low. Because as we know, if we're stressed and anxiety, that also affects our immune system. So we want to keep our body stress-free as possible. So we'll be delighted to be doing that. And also you will be on hand to give some information on how the Smovey Health can affect our immune system and also answer our clients' questions, which is fantastic.
Yes, I think that's one of the things that I'd look forward to, because I know people have lots of questions generally. I like to talk about health, and so it's a good opportunity, assuming that with all that happens, I will certainly be making time to try and speak to the clients and to share with them whatever thoughts and questions that could hopefully help them to understand a bit more about their health and about what's going on in the world.
Yes, yes. Well, thank you very much. I think that's enough for now. And what we will do is be putting regular posts on our Facebook page. And then if anybody wants information on how to connect to our membership, they can send us an email either through the Facebook page or through our email, which is admin@smoveyhealth.com. So
Thank you, Irene. Hope you have a great evening.
You too. Thank you. Bye.
Okay. Bye-bye.
Bye.